Singapore is preparing to more than double the number of community beds to help care for COVID-19 patients during various stages of their illness and recovery. 23,000 beds across various community facilities are expected to be added by June to the existing 18,000 beds. The multi-ministry task force handling the disease response says it's part of managing space requirements. Cheryl Goh reports.
With cases here continuing to spiral, the plan is to ensure there is sufficient hospital beds for those who really need close medical care. But there is still a range of support for the other patients. Those waiting for results of their swab tests can stay at swab isolation facilities such as the Civil Service Club at Loyang and return home only when the tests are negative. Migrant workers at the dorms who are negative but may have other illnesses are housed for up to 5 days in dorm isolation facilities like the Home Team Academy. But if the swab tests were positive, patients with mild symptoms are moved to community care facilities such as Singapore Expo or D Resort, where bed spaces will be doubled soon to 20,000 by end June. Patients who are clinically well after 2 weeks are placed at community recovery facilities such as the SAF Guillemard camp, where they wait to be discharged. There are 2,000 such beds now, and it'll increase to 10,000 by end June. For those who are seriously ill, intensive care unit capacity in hospitals is being doubled. Hospitals are taking active steps to reduce non-urgent clinical procedures and convert dedicated wards that may be activated into ICUs if necessary.
While we have sufficient capacity at the moment, I do want to preserve the buffer that we have, and we must never take a healthcare capacity for granted. It is still important for us to observe the safe distancing and the circuit breaker measures to reduce the number to the extent possible. And even the cases in the dormitories, we also have a plan to address these issues to make sure that we manage the cases properly, to minimize the risk of complications from these patients, and to also to reduce the mortality.
While community cases have come down in the past few days, the key message is Singapore is not out of the woods yet. The government says it's currently conducting extensive testing, including at nursing homes. By doing so, the number will rise again.
These are what they call cryptic or hidden cases, because these are people with very mild symptoms, maybe even no symptoms at all, but they are in the community. They may be self-medicating, thinking that it's just a mild cold and I take a Panadol or I take some flu medicine and it's okay, I rest and it's all right. So there may very well be cases like that in the community, which we are not detecting. If the situation permits, if the numbers do indeed come down, we will look at relaxing some of the restrictions.
The bottom line is, authorities are looking at the numbers very carefully. And if community transmission has really decreased, then yes, some of the circuit breaker measures may be relaxed. But the task force stressed that it will be done in a very careful, calibrated manner. This includes stepping up testing, quarantine, or isolating for selected groups of workers before they are allowed to return to work to jumpstart the economy.